So in my country, Kenya, we have about 12 medical oncologists for a population of about 45 million. And one of the key challenges is that most of these medical oncologists are actually located within the urban center. So you'll find that most of them will be actually in Nairobi and Eldoret and a few in Kisumu. And one of the things that we've realized is the high volumes of patients who are accessing these 12 medical oncologists. So basically meaning that there's a delay in terms of accessing care for these patients. And two, because of this small ratio between the medical oncologist and the cancer patients, you find that there's a delay in basically the patient actually accessing treatment. And also the quality of care, so that there's increased waiting time. And so one of the key problems that we've actually realized is the inaccessibility to a medical oncologist, the increased waiting time to see a medical oncologist. And one of the things that the patients have actually done is we have seen an increased efflux of patients to other countries to seek care that could have actually been provided here in Kenya without that high cost of actually having to travel abroad.
We need more oncologists in Kenya to manage, because most of the patients that you get are usually they come late, or the stages are also late. I mean, too late. They are diagnosed late. That means that from the primary setting, the people who are doing diagnosis are not there, the personnel. So as a result, I think we need more medical oncologists in Kenya to help in diagnosis, in treatment and also diagnosis, and to push the patient to do the treatment earlier rather than waiting until such a late stage.
So the training is equipping me, one, to give me the basic knowledge of hematology. Two, it's equipping me to manage confidently these hematological malignancies. And also it's building up on me to, to actually take up the training and in future actually go for bone marrow transplant training, so that we can actually bring this key important management aspect to our country, Kenya. So far, we don't have a transplant center in Kenya, and I'm hoping to be a key person in actually starting this initiative.
Merck Foundation and University of Nairobi is one of a kind which I think to me would help tremendously, in building the awareness and also to train the oncologists that can help in the treatment of cancer.
It's been an honor for me to have been accepted to the Merck Oncology Fellowship Program by the Merck Foundation. I'm currently in my first year, and I'm the second batch of medical oncologists who have been trained. And I've actually learned a lot from my colleagues who have been trained, who have actually been in the program for 1 year. And it has been an eye-opener for me in terms of the interactions that we've had with them. One of the key advantages of this Merck Oncology Fellowship is that it's going to boost the human resource capacity that then can be able to take care of these patients at their roots, so that the patients don't have to travel. So you eliminate the bottleneck of patients seeking care. Initially, there never used to be training within the country. And so one of the things is that the doctors actually had to travel outside the country. And if you find that you have young children or a young family, then that becomes a bottleneck for you. So the Merck Oncology Fellowship Program coming to our country, Kenya, in partnership with the University of Nairobi, has actually been a big advantage for me because then I can train from the comfort of my country. Two, I don't have to think of the financial implications of training. And 3, I am actually training with the kind of patients that I'm actually going to come and treat. And so I've been very grateful for the opportunity that this Merck Oncology Fellowship Program has provided.